Good morning, Representative Scott. My name is Pat Worley.
Hi, Pat. It's nice to meet you.
Nice to meet you. I am a student at the University of Texas at Arlington. I'm in the master's program for nursing administration. And currently we are in our healthcare policy course. And part of this is tracking a legislative bill that we are working on, that we were able to choose, and it's House Bill 2099. And what this bill focuses on is higher education for nurses. And looking at this bill, what it does is it looks at ways that we can increase accessibility to our nursing programs by looking at a universal electronic submission record so that we increase enrollment, there's accessibility, but that it encourages nurses to go back and achieve a higher advanced degree. And it also talks a little bit about nursing faculty shortage, but that really isn't the driver of today. But what I'd like to do is, get your take on this bill and see if there's any way that we can together take action on how we can move this bill.
Well, this is a very important bill, and in Texas we've been looking at the shortage of nurses and predicting what that would look like going into 2020. And recognize that the number of nurses that we need and the number of nurses coming out of nursing schools across the state would be insufficient to meet those needs. So the coalition, the Texas Nursing Workforce Shortage Coalition, is a group of policymakers like myself, academic institutions, hospitals, all coming together to find solutions to meet this shortage. And House Bill 2099 is one of a very important positive milestones that we've met on this journey. Included with the easier accessibility through the electronic admission process is a tuition reimbursement.
Yes, absolutely.
Yeah, and they're looking at it's $7,000 per nurse after the first year. But when you look at those numbers, what you find is that it would get you roughly to about 3,500 new nurses graduating from the system, and we really need more towards 5,000 in order to meet goals by 2020, goals from the IOM, goals to meet shortages. So there's still there's a continued need to push legislature, to push the government to increase the amount of monies that we're putting towards this.
I agree, and I think as nurse leaders and we need to become actively involved in creating this awareness and being in the community and
Yes.
joining these forces,
Yes.
so that as we advance our profession, we are able to do exactly what this bill's asking for and encourage our nurses to go back and achieve a high level of education.
Yes.
One, to meet the ever-changing healthcare system that we are about to